So good morning, good afternoon, good evening, everyone. It's our great pleasure to welcome you to this online seminar hosted by SIGWELL and the Global Health SIG on the impacts of extreme weather events on the health and well-being of local communities. So I'm Claudia Libanio, Associate Professor in the Federal University of Health Sciences in Brazil and convener of DRS Global Health SIG group.
And I'm Leandro Tonetto from the School of Industrial Design here at the Georgia Tech, Georgia Institute of Technology in the US. I'm representing SIGWELL as our convener. So I would like to invite you all to join our SIG LinkedIn groups to stay connected, to get communications about our future events. I would like to quickly thank my school for supporting the organization of these events, and Sarah Harris, our grad student who's here and who made it all happen.
And I'm honored to introduce today's session, which brings together distinguished scholars and experts to address one of the most pressing challenges of our time. Extreme weather events, intensified by climate change, are having profound effects on communities worldwide. From the increased frequency of hurricanes and wildfires to flood disasters and heat waves, these events disproportionately impact vulnerable populations, exacerbating existing social and health inequalities. Today, we will explore these critical issues from multiple perspectives, including urban resilience, healthcare design, and systemic responses to climate-related health challenges.
And we are delighted to have four great speakers with us. So I'll quickly present them and we can get going. The first in the lineup is Professor Yiyi He from Georgia Tech here in the US. She will examine the impact of climate change-induced extreme weather events on vulnerable neighborhoods. Then Professor Tarcisio Saurin from the Federal University of Rio Grande do Sul in Brazil will discuss design for resilience in response to recent floods in southern Brazil. Professor Emmanuel Tsekleves from Lancaster University in the UK will follow presenting strategies for tackling community health challenges on a global scale. And last but not least, Bárbara Hein Machado from Loughborough University will address how design can mitigate systemic barriers and improve healthcare experiences for people with disabilities. Just a very quick explanation. In the seminar, we'll have an opportunity to get to know four different perspectives. That's the idea. So the talks are short, from 7 to 10 minutes each. Your questions will be asked after the fourth speaker, so after Bárbara. Drop your questions in the chat. We'll group them by similarity and present them for discussion with our panel, so after Bárbara. So again, thank you for joining us, and thank you in advance for our speakers. So I would like to invite Professor He to start the presentation. Thank you.
Well, hi, everybody. My name is Yiyi He, and I am an assistant professor here in the School of City and Regional Planning at Georgia Tech. My research looks at the intersection of climate change and extreme weather events, and also understanding their effects on both the built environment as well as the social fabric. And today I'm excited to share some of my thoughts with you guys on how climate change impacts vulnerable neighborhoods and how we can better plan for more resilient communities. So let's start with something that we all know. Climate change is a global challenge and is hitting our cities and neighborhoods in very real ways. NASA's reports show that with climate change, the frequency and severity of extreme weather events are increasing dramatically, and we're experiencing more frequent heat waves, heavy rainfall, droughts, and hurricanes. These events not only endanger lives, but also cause significant damage to our infrastructure. They disrupt agriculture and stress many economies, large and small. However, the impact isn't evenly distributed. Some communities suffer disproportionately than others. On this slide, I show the devastating floods in southern Brazil in 2024, which I believe many of the speakers will mention today in the seminar. The flooding began on April 29th, 2024, triggered by rainfall that far exceeded seasonal averages, and this resulted in widespread destruction and loss of life. When we compare the satellite images captured before and after this flood event, we can clearly see how the urban landscape was overwhelmed. And events like this are not isolated incidents. They reflect a growing trend associated with climate change. Professor Tabari demonstrated in his recent publication the intensification of the hydrological cycle due to global warming, and the likelihood of extreme precipitation events and the risk of flooding are expected to increase significantly, particularly towards the end of this century. When different types of hazards interact in time and space, which is also known as compound hazards. A good example is the Montecito debris flow in Southern California in 2018, which happened after wildfires and was followed by heavy rains. And when disasters overlap like this, and it's even harder for the communities to bounce back from it. Luckily, with the advances in tech and modeling, it gives us some powerful tools to predict and understand future climate variations. For example, the CIMIP-6 global climate models provide projections under various climate change scenarios. And these models operate usually at very coarse spatial resolutions. We're talking kilometers. And we must apply physical and statistical downscaling to evaluate the localized impact of individual or compound hazards on communities. And I believe this is key for creating targeted responses that fit each community's unique context and their needs. Here's an example of how our research group applies these techniques. And we use a model called 3DI. It is a two-dimensional hydrodynamic model to simulate flooding in vulnerable neighborhoods. We use LiDAR data and to create high-resolution digital surface model, which help generate time series of flood inundation maps. While physical simulations like this require substantial computational resources, but they provide invaluable insights on how flood exposure, what is the flood exposure in the communities, and what is the inundation extent and depth. Understanding the physical exposure, I think it's only half of the picture, and the other half of the picture is the social vulnerability of communities. So, inspired by Susan Cutter's work, we developed a framework that integrates both physical and social vulnerability, resulting in what we can call place vulnerability. And I think this holistic approach allows us to assess not just where hazard might strike, but who is most at risk and why they are most at risk. So here's a case study from a previous project where we assessed flash flood risks in a vulnerable neighborhood. We focused on a specific watershed that the neighborhood belongs to and used the same hydrodynamic model to simulate a 24-hour storm event. And the output gave us a detailed view of the flood inundation depth and extent in the neighborhood. Using this data, we could map the physical vulnerability of neighborhoods to flash floods at a very high spatial resolution, about 0.5 or 1 meter spatial resolution. We also evaluated social vulnerability using 32 different indicators. For example, income levels, age demographics, and access to transportation. This slide highlights the 5 indicators at household level, and each point on those maps represent a footprint of a home. And by layering this data with physical exposure, which we modeled before, we can get a comprehensive understanding of the communities at risk. By combining the social and physical vulnerability, which I mentioned, at the household level, provide a nuanced view of the risks these communities face. On the right-hand side of the presentation slide, you can see a hotspot analysis map of the place vulnerability index, which we calculated before. The red zones indicate clusters of high vulnerability, and these are areas that should be prioritized for climate adaptation measures to enhance their resilience to flash floods. And these results are later communicated and when we get engaged with stakeholders to better understand what are the exact measures suitable for the communities. To conclude, I wanted to wrap up with a framework that integrates all of the models that I've discussed into practical planning applications. And we use physics-guided machine learning models and downscale climate projections to predict and to assess compound hazards under different climate scenarios. And these predictions are later integrated with, for example, network data to explore potentially cascading effects in the communities. We don't just work in isolation. I think it's important to engage with high-risk communities and foster a dialogue and collaboration with them. So this would be the end of my presentation today. Thank you so much for your time and for your attention. I look forward to your questions at the end and thoughts on how we can collectively build more resilient communities in face of climate change. Thank you.
Thank you for this thought-provoking presentation, and thank you for correcting my pronunciation in the beginning. We are now moving from climate change and resilience to design for resilience. So thank you for the link. Made my job a lot easier. And then I would like to invite Professor Tarcisio Saurin to make his presentation.
So the title of my presentation is Design for Resilience and the Floods in Southern Brazil. So you have heard an introduction about the floods from the prior speaker. I'm a professor of industrial engineering at the Federal University of Rio Grande do Sul. So I'm speaking from the area affected by these floods, which is the southernmost state in Brazil, called Rio Grande do Sul. And as the prior speaker said, last May we had the worst floods on record in our region. Before that, our worst flood on record had occurred in 1941. So this type of disaster was no longer in the living memory of most people. And so to a large extent, the scale of the tragedy was a surprise to most people. I have here some photos, some additional photos that can give you an idea of the implications of the disaster. On the top left, we have an image from a dam. There were several dams affected. One of them collapsed. There were also more than 100 hospitals affected. In several of these hospitals, it was necessary to evacuate patients at short notice. There were also serious implications to logistics, especially in terms of road transportation. And maybe one of the most impactful disasters occurred in our airport, which was closed for 5 months. So a question that inevitably arises from this type of disaster is regarding what societal resilience looks like. So I have here a definition of what I mean by societal resilience. This definition is from the Norwegian Parliament. They define societal resilience as the society's ability to maintain critical social functions, for example, healthcare provision, public transportation, education, to protect the life and health of the citizens, and to meet the citizens' basic requirements in a variety of stress situations. So, based on those pictures I showed you, it's clear that societal resilience was not good enough during the floods last year, because we are still recovering for our infrastructures, and we are still coping with the consequences. So, in line with the topic of this seminar, I will emphasize from now on the idea of designing for resilient performance. This concept and these principles that I will discuss here, they also apply to societal resilience. We have been working on this concept for several years. On the bottom, I have listed some papers that present these concepts in detail. But we have defined design for resilient performance as the use of design principles to support integrated human, technical, and organizational adaptive capabilities. So this concept takes a social technical approach to designing for resilient performance. And these resources and structures deliberately designed, they also support the informal self-organization experience and test knowledge of volunteers, people in general. So there is a designed dimension of resilience, and there is an informal self-organization dimension of resilience. These two dimensions interact with each other, and they give rise to resilient performance as an emergent phenomenon. I said that the concept involves the use of design principles, and here are the principles we have been working on. Unfortunately, I don't have time here to go into details of all principles, and I will just provide some comments on principle 4, which is related to designing Slack resources and strategies, and principle 5, which is related to designing for acceptable performance under degraded conditions. Principle 4, Slack. Some of you may be familiar with the concept of buffer. Slack is a quite similar concept. And the definition of Slack is a cushion of actual or potential resources which allows an organization to adapt successfully to internal or external pressures for adjustment. These resources can take a variety of forms. The most common are people, materials, space, money, time, equipment, and procedures. There are several interesting and challenging questions related to the design of Slack. Perhaps one of the most interesting is how much Slack is enough. This problem is usually represented through an inverted U-curve. You can see here on the top left. On the vertical axis, we have resilient performance from none to most effective. And on the horizontal axis, we have the amount of Slack resources. And as you can see here, there is a sweet spot on the top of this curve, which means the most benefits to resilience and an average amount of Slack resources. But in fact, despite this nice curve, what counts as best amount of Slack resources also depends on the different viewpoints of stakeholders. what counts as sufficient slack for one stakeholder may not be sufficient from the viewpoint of another stakeholder. Another interesting design question is related to the time required for the mobilization of Slack resources. Ideally, the Slack resources should be available for immediate deployment without no waiting time. Another design question, introducing Slack in a system means changing the system. And if the system is complex, like a society, like a city, there will be always a possibility of unintended consequences of using Slack. And finally, another example of design question relates to the opportunistic manifestations of Slack, regarding whether these opportunistic manifestations should be turned into designed Slack. What I mean by opportunistic Slack? Opportunistic Slack is the one that was not designed to serve as Slack. The decision to use these resources as Slack usually takes place on the spot, under time pressure, and without prior planning. Some examples regarding the floods last year in Brazil. There was a nearby airbase that was used for commercial flights. This airbase coped with only a small fraction of the commercial flights, but anyway, it was helpful. Another example, rice farmers in our region, they lent pumps to drain the airport. You can see here some pictures of the equipment they deployed. This was very fit for purpose because the airport involves a huge area, and this equipment worked very well in this context. And on the bottom left, another example, it was necessary to find temporary areas for the disposal of debris. There were huge amounts of debris, and this is still a problem a year after the floods. And a few comments regarding Principle 5, the design for acceptable performance under degraded conditions. This principle is especially important for disaster management. A disaster is a degraded condition. And I have here some pictures from Asia, but we have similar situations elsewhere in the world, where architects design buildings in such a way that the ground floor can get flooded, because the ground floor was not designed for occupation, for living. So I think these pictures are self-explanatory in this regard. So, and just a final slide, a bit of marketing here. This year in October, we will be organizing in southern Brazil the biennial symposium of the Resilience Engineering Association and the annual Resilient Healthcare Society meeting. These are the main international symposiums of resilience engineering. And here's the conference website. I invite you to have a look, and you would be welcome to be with us this October. So thank you very much. That's it from me.
Thank you, Tarcisio. Another great, interesting presentation. And I think this topic connects really well with the next one, because we are now moving from social resilience to community health. So let's invite Emmanuel to deliver his presentation.
Good day, everyone. It's a real pleasure to be here, and we're gonna kind of continue this virtual travel that started with South America and Brazil and Asia, but I'm gonna take you more to Africa. A few years ago, I was part of a delegation from our university I went to Africa to work with communities and explore what might be some of the challenges they're facing. We joined a meeting like the one you see here called a Durbar, where traditionally you have elders discussing matters. So there were a lot of my colleagues sitting around there asking people, what challenges you face, how can we help? As they went through it, I noticed that there was a person sitting next to me. Coincidentally, he looked like an estranged brother of Morgan Freeman, Ghanaian style though. And he was in very deep contemplation. He was thinking. I said, what about you? What would you like, the research to do? He turned to me, thought for a 1.5 seconds and said, I just want one thing. I just want you to come back once the project is finished. Many researchers, they come here, they collect the data, and then they leave. Now, this statement had a profound impact on me and my research practice since then, and of course uncovered a challenge that does happen with so-called mosquito researchers that go in and flying in the data out and then writing publications and people that have been involved in the communities, they never really benefit from the research, or they never found it about it. And as already mentioned, we've facing a lot of challenges. There's obviously an intersection between climate change and health. And of course, design research methods can help in understanding better, contextualizing these problems and co-designing in interventions. But a challenge and a question for everyone to think about, maybe in the discussions, how do we ensure we come back after the project and finally has finished? So how do we continue that work, especially when we engage with communities? I'm going to situate in a research project we did. We had received funding to explore the use and misuse of antibiotics, and we wanted to look at how we can stop that vicious circle, and we wanted to understand how the way we clean the homes determined how often we get sick, and therefore how often we need to take antibiotics. And we've worked with communities in Greater Accra, the capital of Ghana, looking at different socioeconomic criteria to develop an understanding. This was an interdisciplinary project. There was a lot of design research methods, as you can see, to try to understand the cultural practices, the cleaning practices, a lot of design ethnography, but also we work with epidemiologists and microbiologists to collect also samples of dust, hence the name Dust Bunny, that gave us a picture of the presence of good and bad bacteria, let's call them, within the households. And we then took this data, translated in a visual form, and brought the households that were involved back to actually explore, understand what was in their homes, and together we co-design cleaning interventions. I don't want to talk about the outcomes of the project, but more about what happened afterwards, because we had messages like these ones here, that showed that the interventions that communities co-design had an impact to them, and they started spreading the word around. So we're fortunate enough to secure some internal funding from our university to actually explore more how do we scale the impact, what we got from the research project, not doing any more research, and engage with wider community groups, but especially with school teachers and policymakers. How can we take that into the schools, but also change some of the policy of the country around that, and how we can create, we can reach as many people as we can. We use the concept of change agents, and the idea is that when you engage with specific group members, and in this case school children, they're the perfect dissemination vehicle, because actually from young age, if you've involved them into the process, they can easily understand. This becomes part of them, and then later on they share it with their siblings, with their family, with the wider community, and the word spreads around organically. We had a tight timeline that involved engaging with the different stakeholders, co-designing a number of activities with school teachers to help them design some extracurricular activities that could incorporate within their teaching syllabus at schools, but also explore with policymakers how can we make some changes to the policies. And also we run what we call a living lab, activities and seminars that would demonstrate to the children, right, the impact of hygiene and cleaning and a lot of activities afterwards. So these are some examples of the activities with policymakers and school teachers. It was really funny. The school teachers were so enthusiastic they even created a song about the project. So we've got a song that talks about the findings. But our living lab, we use the concept of very quickly visualizing the invisible, and that's when you deal with germs. What you see on the screen is an agar plate, is a bread and butter for those working in microbiological labs. Basically, once you introduced anything like even your fingers, after a while, after certain temperatures, you can start to see the bacteria developing. So we thought, right, this is a vehicle that we can use to visualize the invisible. So as part of one of the activities of the Living Lab, we engage with local stakeholders and charities, and of course the school teachers. We had students running around and taking a hand imprint without washing the hands, washing it only with water and washing it with water and soap. And then after putting it in the right temperature, we brought it back. And as you can see here, the different images, you can see that you can easily visualize, the impact of washing or not washing with soap. This led to further activities and even guest lectures by colleagues of mine, but different organizations also within Ghana and local NGO groups, so that school children will be trained and also taking this back to their homes. What was the important thing is that it caught the attention of some media. We had documentaries done by Ghana TV, which is the national broadcaster. They've interviewed local researchers, and it was aired several times on the TV, reaching several million Ghanaians. And in fact, our colleagues there, they were receiving phone calls from people having watched these documentaries, asking more about the research. But the key considerations to take forward for design research doing this type of work is if you're involved in any type of community project, whether it is in healthcare or not, I would say think about how you can incorporate equitable partnerships right from the start. Develop those participatory mechanisms that we've seen in other projects that were quite useful, and therefore having resources for them. And started thinking right from day one, how will you disseminate beyond academic outputs, and what will be the legacy, what happens after the funding, after the project finishes, how can the local communities take this lesson forward? And the most important thing, always ensure, you come back after the project has finished. I'm going to stop it there, and I'm sure there will be questions to be asked later on.
Thank you, Emmanuel. Always a pleasure to learn more about your work, engaging different stakeholders. It's really really inspiring. With our next presentation, I think we have a logical flow from yours. So we will invite Bárbara Machado now to focus in health challenges specifically for people with disabilities. So it's all with you, Bárbara. Thank you.
So thank you very much. I'm very happy to be here. And today I have a few minutes to share with you some insights on how design can address systemic barriers and improve the experiences of people with disabilities. So I'd like to start by saying hello. So I'm Bárbara again, and I'm hard of hearing, and I'm from Brazil. and I'm a doctoral researcher at the School of Design and Creative Arts in Loughborough University. And my research is about how to improve engagement and participation for people with disabilities in healthcare situations, which aims to improve the health, well-being, and safety of people. Okay, so I'd like to start by bringing some common issues we have in healthcare situations, that is in my expertise, and in extreme weather events. So whether you are a patient or you are in emergency or you are someone dealing with a flood, you experience higher levels of vulnerability. So you need to rely on systems and people to protect you. And you also have a reduced autonomy, and we have high-stake decisions, which means that decision made in these two contexts, they have a lot of risks involved. And we also have a crucial need for trust. So we need to trust in our doctor in order to follow their recommendations, and we need to trust the government, the authorities, in order to follow their instructions. But not everyone will experience vulnerability, decision-making, trust in the same way. And when we have emergency situations, when we have critical situations, who gets left behind? So we need to ask ourselves about that. And I'd like to bring the story of Gino Luis Corneli, is a deaf man that shared his experience during the floods in Rio Grande do Sul in Brazil. And the news article about him is called "I Woke Up with the Smell of Water, the Climate Tragedy of Rio Grande do Sul Experienced by the Deaf." So one quote from him really caught my attention. He said, "Thankfully, I had friends who helped us, rescued us, and were able to notify your children. But the hardest part of this whole situation was definitely the communication barrier." So this is a reality for people with disabilities. In addition to being worried about their health, their body, their well-being, their home, their family, they also need to worry about the barriers they're going to find when navigating these situations. So this was a common scenario for the deaf during the floods. So they experienced barriers at every stage of the situation. So during the floods, there was a lack of accessible information. So if you are deaf and you use sign language, you may be difficult in understanding written information. So the communication needs to be adapted, which didn't happen during the floods. And the rescue teams were unable to communicate with these people, which resulted in isolation and confusion. And then in the shelters, there was a lack of awareness. So the teams involved in the shelters, they didn't realize there were deaf people among them. And this relates to the nature of this disability. So if you have a hearing loss, you have a hiding disability, you often can see that you are a person with disability. By the way, this is the sunflower linear, that means that we have a hiding disability. But it's different if you use a wheelchair, so people can see in a faster way that you may need a different accommodation. But with deaf people, it may take a while till someone provides some assistance for you. So still in the shelters, there weren't no interpreters and a lack of adapted materials. And when returning Rome, when assessing government support, there was difficulty in navigating the systems, so the interfaces were not accessible, which increased their social vulnerability. So when we are talking about the barriers in a system, we need to recognize how complex is this issue. So this is the SIPS model very used in healthcare for patient safety, and is very useful for this context as well. So we have the person at the center. It can be Gino, for example, someone with a disability, and this person is going to interact with organizational factors, with the internal environment, such as the physical aspects, is going to interact with tasks like decision-making, and with tools and technologies in the external environment. So we have multiple components of in a system. And through these interactions, a lot of barriers can arise. So it's important to have this whole picture and how we have so many different actors that can really impact the experience of this person. And when we talk about the system, we need to have consider the social perspective of the disability. So the issue is not in the person, is not in the disability, but is outside, is in the dynamics, is in the services, in the environment. So I'm deaf and I can't fix my deafness. What can be made is around me, you know. So by this perspective, we can say that a deaf person can attribute the communication barriers they encounter as the disabled factor instead of their diagnosis. And a very interesting concept of disability by the inclusive design research is design can be experienced, disability can be experienced by anyone excluded by the design. Accessibility is, therefore, the ability of the design or system to match the requirements of the individual. As people with disability have so many different needs and multiple identities that can interact with disability, one size approach doesn't fit all. So, for example, I'm deaf, and Ginon, that example that I shared, is deaf as well. But I use spoken language and he uses sign language. So our experiences with disability is different. So we are not going to experience the situations in the same ways, even with we are both deaf, you know. So developing strategies that work equally well for all people is an effective, and when designers do that, they are creating a self-reinforcing cycle of lack of accessibility. And Sasha Constanza Schock, she's an author of the book Design Justice. She brings three important questions that we need to consider when we are talking about people with disabilities. And she shares who benefited from the design, who was harmed by the design, and who participated in the design process. So to change the system, it's important to have co-design approaches. So it's about building with people with disabilities and not just for them. So this is aligned with the principle nothing about us without us. It's from the disability movement principle, no? And it's about including people with disabilities in all stages of the process when developing a solution, when thinking about how to solve a problem. So we need to bring people with disabilities, their voice in all stages. And I'd like to just summarize this presentation by saying that design can be a powerful tool for people with disabilities when it amplifies voices, facilitates participation, and improves the support. That's it. Thank you very much.
Thank you, Barbara. It's very disturbing to think that designers talk a lot about co-design, empowerment, and so many people are left behind in this in our projects, right? Thank you so much for your presentation. So going back to our first presentation, to discuss a little bit more about climate change in extreme weather events, we have two questions here, and we encourage you to keep posting or keep sending your questions. We'll try to ask all of them. How do you envision the idea of application of this technology? Do you see it being most useful for flood relief efforts, guiding new construction, or reshaping the existing urban landscape?
I personally work a lot with flood hazards, and even within floods, you have different types of floods like pluvial, fluvial, coastal, flash floods. They're all very, very different. And there are different ways of modeling just flood hazard alone. And I've also have the pleasure and honor to know and work with other researchers and colleagues here at Tech and also from previous universities that I've stayed in that looks at other types of hazards. For example, in California, wildfire is very a big issue in California, and there's a long wildfire season, and there's a fire who just burned down houses in the LA area, and there are different both physical or statistical models to do that, and they each have their pros and cons, and same exists for other types of hazards like tropical cyclones, hurricanes, and earthquakes. So I guess with the tools that I mentioned, I mainly mentioned the physical approaches to understand extreme weather events. And also there's another camp, a whole group of researchers who's a big fan of using statistical approaches to understand the impact of extreme weather events. And I think they all have their unique, and depending on the project and the research and the community, I think, and the data, of course, different approaches can be used. And depending on the application, I also think a big question is what kind of scale you're looking at. If you're looking at a household level, then the approach that you would take might be different. Maybe a physical one might be a little bit better than many of the statistical ones, purely because of the data that's available with the statistical approaches, which are oftentimes remote sensing satellite images. Hard to do in a very high spatial resolution. And yeah, I don't know if I answered the question, but if there are like follow-up questions, I'm happy to answer them.
There's another one here. Are there specific policy changes that you hope your work will inform?
FEMA is currently looking into compound hazards, but there I hope with me and also other researchers who work in this domain, we could maybe push the boundary a little bit with trying to understand compound hazards. When I say compound, I don't just mean that we're adding one hazard exposure on top of another. It's not a simple addition of one and another. When I mentioned the monocellular debris flow, the compounding effect of wildfires, which in that case burned down the soil and disrupted a lot of the root system of the trees and bushes in Southern California, and followed by atmospheric river level, I think 5 or 6. I couldn't, don't quote me on that. But it's not like simply modeling the two hazards alone does not solve the problem. We have to develop some kind of way to understand the actual interaction between multiple hazards. So I wish and I encourage many other researchers and designers to work together and figure this out, because we're experiencing more and more compounding events, and we are yet to have a really good model and really good way to understand and also to build resilience for our communities.
Thank you so much.
Yes, we have a question regarding the second presentation for Professor Tarcisio Saurin about, you mentioned informal self-organization as a way to build resilience. How do you see design supporting this? I mean, design as a process.
First of all, I think it's important to make it clear that any living system is resilient to some extent, whether or not there is any design. So a society as a living system is resilient to some extent. And regarding a practical example of design supporting informal self-organization, I can mention the situation of volunteers who work as first responders just after the aftermath of a disaster. In many situations, like we had in Brazil last year, there were many volunteers happy to help, but there was a lack of coordination. So if there is some supportive structure from government, from the government, for example, there can be a more effective coordination and the best use of these volunteers. I don't know if this helps, but volunteers are mostly people who take the initiative informally, but they would benefit from some support from structures from a government.
Wonderful. There's one interesting question here for Emmanuel following up. Are there ways for people to come back to a community without physically being there if resources don't allow? How might technology or design help maintain that sense of connection?
Absolutely, which is why in my slides I had to come back inside brackets. Yeah, and that's what we actually did in that project as well. So it was a combination of a few in-person visits, but a lot of it was virtually continue to engage with the key stakeholders. We had created the connection when we were there, following up, and even a lot of the workshops and lectures to the students and activities were facilitated online. So there's still a lot of things we can do to continue that communication, continue that dissemination and training as well. You don't need to be physically present, but you need to make the time and make it a priority of yours.
Thank you, Emmanuel.
Great. And for Bárbara, the last but not least presenter, how can co-design be leveraged to ensure that people with disabilities are not just included, but actively shape solutions for disaster resilience?
So I think this is the challenge, is to an adequate support to provide a space for people to participate and contribute. I think that we need to recognize how different are the experiences of people with disabilities, and to have accountability as well, is to give power to these people to create together with the designers. And I think that for now is what I'm still exploring my research. I'm trying to understand how to co-design with deaf people to engage, to improve their participation in this process, because when we have deaf participants, we have communication difficulties. So this is a challenge that we need to explore, how we can create a support for these people to better participate in this process. So yes.
Thank you.
Thank you so much, all presenters. I'm sure I speak for all of us to say that the 4 presentations were very provoking, and we'll be happy to share your presentations within the DRS community too. Okay, so thank you so much, and have a wonderful rest of your day.
Thank you so much.
Bye-bye. Thank you.
Thank you very much.
Thank you.
Thank you. Ciao.
Ciao.